the UN Secretary General recently told leaders of the world's richest nations that every country on Earth is in a fight against the COVID-19 outbreak, but they are not winning it. The recent pandemic has shown us that all the countries are essentially having to go it alone. Huge multilateral efforts and organisations like the EU, the WHO or the UN Security Council have been unable to come together to tackle the crisis. So the pandemic is global, but the actions we've been seeing are almost strictly down to national lines. So the big question, can countries come together to overcome this unseen killer? Today we have joining us Dr. Ramon Pacheco Pardo, a reader of international relations at King's College London, Dr. Joseph Bosco, former China Country Director in the US Office of the Secretary of Defence, and Dr. Mark Shanahan, Associate Professor of Politics at the University of Reading in the UK. Well, first of all, Dr. Pacheco Pardo, many Europeans have called for the issuance of joint European debt to fight the pandemic, but this has been met with high resistance from Germany and the Netherlands. How likely are the bitter feelings of the 2008 global financial crisis likely to re-emerge at this time?
Well, we see whenever there is a crisis, an economic crisis, a migration crisis, for example, the European Union is blamed by some member states. This happened in the 1990s, 2008, 2015 as well. So I think this is unsurprising. We have also seen how within Germany and the Netherlands there is a debate about whether to pursue corona bonds or not. It is true that some members of government in these two countries are opposed to corona bonds, but it is also true that major politicians, political parties, economic leaders in both countries are saying that this is a good step that the European Union should be taking. So I think these divisions will continue within Germany, within the Netherlands as well. We will continue to see criticism of the European Union, but ultimately we'll see more of a joint response from the European Union. We're already starting to see that, and I think this will continue in the coming weeks and months.
As you said, we've seen nationalism versus multilateralism in the EU. And, well, Dr. Bosco, who's joining us on the phone from Washington, D.C., well, across the Atlantic where you are, the Trump administration actually asked 3M to stop exporting their masks to Canada and Latin America, which really angered those governments. And at the same time, officials in Berlin criticized the United States on Friday, accusing it of diverting 200,000 masks from China. Meanwhile, China and Russia are giving away masks to other countries, including those in Europe. Well, what do you make of this move? And do you think some countries are actually taking advantage of geopolitical cracks to expand their sphere of influence?
Well, it certainly is a complex situation with 151 countries involved and 50 American states. The question of how to distribute the stockpiles that we have and the ones that are being created is a very difficult one for the administration. I'm sure there are countries, really specifically China and Russia, that are taking advantage of the confusion around the world and the desperate efforts being made to score geopolitical points. But I would note that I think you used the term giving. China is giving away. I think they're selling this equipment, but more than that, a lot of it has been quite defective in, I think, the Czech Republic and Spain and Italy and Turkey and the Netherlands have all returned some of the masks and other equipment, indicating that they are not usable. So there are games being played. It's unfortunate in a situation of such terrible tragedy around the world, but it's happening.
Well, it's unfortunate that if some governments are seeing this pandemic as a zero-sum game rather than, trying to cooperate. Well, Dr. Shanahan in Reading, the UN Security Council, the members in the past, they actually came together to voice their resolve against threats to global security, including health, like the Ebola epidemic in West Africa in 2014. Why haven't we seen that kind of cooperation this time around?
There's a huge amount of suspicion between nations at the moment. So if you think of the UN's foundation in the wake of the Second World War, whether people were victors or losers within that war, there was a huge drive globally to put the world back together, to have functioning economies across the world, to grow trade between nations once again, and to have a situation that was not going to fall into war once again. With the pandemic, it's a little bit different. It still seems that we are falling back into nationalism. There's a lot of populist leaders around the world, but the feeling is that one puts one's country first, sticks up the barriers, sticks up the borders. You look at America, which is under Trump is very much America first, and you sort out your issues at home and then think about your neighbors and those people further away. Now, the problem is we have a global pandemic that doesn't respect borders, so these nationalistic tendencies are going to harm rather than ease the situation.
So what you're saying is that we're seeing a lot of distrust between nations, and that's been fueled by populism and nationalistic sentiments that really isn't helping. And, well, we've seen squabbling between the United States and China recently. And, well, in recent days, it does seem to have subsided a bit, and they seem to have caused some kind of truce. But Dr. Bosco, do you think this truce will be long, it will actually last? And do you think China and America, they will be able to work together to overcome this pandemic?
Well, that certainly is the question of the moment, isn't it? But I think we need to keep in mind that this virus crisis, which has erupted in the last couple of months, is not the real cause of the differences between China and the United States, for that matter, between China and the West generally. There are some serious underlying issues of both interests and values that are at stake, and we have the Xi Jinping administration, which is taking quite an assertive and some would say aggressive stance on all kinds of issues: human rights, South China Sea, Taiwan, trade, and as a result, this is one more issue on top of the others, which has exacerbated the relations between the two. I'm not particularly optimistic at the moment that these issues can be resolved with all the underlying problems that exist.
Well, of course, this isn't just a health issue, but an economic one, and looks like a geopolitical one as well. But the G20 leaders, they did come together in late March, and they said they would do whatever it takes to safeguard their economies as well as their healthcare systems. However, the commitments don't seem to have turned into concrete actions from the leaders. And Dr. Pacheco, Pardo, what kind of actions do you hope to see from global leaders?
I think it's going to be difficult for the G20 to come together with a coordinated package. At the European level, we're starting to see some programs, like the Commission has a 100 billion employment program. The European Central Bank is buying debt from EU member states so they don't have to pay such a high interest rate. There is talk about a second Marshall Plan, probably by the European Union. So I think at some level there can be cooperation, but I think at the global level this is very difficult to see. We have talked before about the distrust between the US and China, which is no short term, as Dr. Bosco said. So I think it would be very difficult for both of them to come together with other countries, let's say like Asian powers such as Japan, Korea, plus the European Union with a coordinated package. So I think we'll have to look this at the European level, and maybe some other countries that might want to cooperate among them. Maybe in Southeast Asia, some people are talking about making this an opportunity, like the one we saw in 2008, to create the Chamba Initiative multilateralization, to create the new mechanism. But I don't think this is going to happen at the global level, to be honest.
So, well, this could really be an opportunity to make or break multilateralism, but unfortunately we don't seem to be seeing any encouraging signs of that. Well, Dr. Shanahan, what do you think? What kinds of efforts do you think are really needed in the coming weeks and months, it seems?
Probably some rather more sensitive leadership than we're seeing at the moment. One of the big problems with international organizations is their lack of power at the center, that they rely on the goodwill of the major nations, the United States, China, Russia, the European Union as a power within them, to come together and work collectively. And we're not seeing that at the moment. Don't forget that this is in the United States, this is election year. And we still have a president who's looking to try and score some political points rather than just save lives. At the same time, in Russia, you've got Putin, who's trying to change the constitution so that effectively he can stay in power for another decade. They're looking to see if and how they can use the COVID-19 situation to their political advantage, which is really awful at a time when so many hundreds of thousands of people will be dying. They've got to get away from that, drop the partisan politics, look at how you can actually have some joined up cooperation across nations, across continents, to find solutions that mean there is far more testing. That means we get to a vaccine quicker. That means that we get out of this situation.
So, Dr. Shanahan, what you're essentially saying is that our countries, the countries around the world, we need to move away from partisan interests within countries. We also have to foster more a spirit of cooperation between countries as well, and totally agree with you on that. Well, I'm afraid that's all we have time for today, but it's been a very interesting discussion. Thank you very much for joining us, Dr. Ramon Pacheco, Pardo in London, Dr. Joseph Bosco in Washington, DC, and Dr. Mark Shanahan in Reading.
Thank you.
Thank you.
Well, this is also where we wrap up our show today. Thank you for watching, and do join us again at the same time tomorrow for more global insights from experts from around the world. Goodbye.